And for this live, we'll be talking about. Let me increase the brightness. All right. So for this live, I will be running through some antiviral drugs. Okay. So I think I have about 50 antiviral drugs to run through. Okay. So it's strictly pharmacology. You can see it's the night time, but I'm up walking. All right. So you walk non-stop. So please, if you're watching this video, for every video I'm recording for pharmacology, I'm not uploading it on MBBS Niger. I'm uploading it on my new this thing. What do they call it? New channel for pharmacology. So I'm going to comment on this live with the name of the channel. Okay. So the name of the channel is Sokoto Pharmacology. Sokoto is spelled what? Sokoto. So Sokoto is the name of a place in Nigeria. Okay. So let me comment. All right. So I just commented right now, but that's if you are watching it on this live. Okay. So, but if you are watching this video later on, just simply know that the name of the channel is Sokoto Pharmacology. Or you can as well as comment on the live, or just comment, use a comment section. I'll post you the name of the channel. Okay. So let's keep things going right now. Okay. Let's keep things going right now. So let's quickly run through the first drug. Okay. We'll be going drug by drug. Okay. Be running through 50 drugs this evening. Okay, so I think it should be a long life, okay, about an hour or so. So the first drug we should be talking about is pharmacology, is the drug known as what? Acyclovir. Okay, pharmacology of acyclovir. So what we have here is this. I have all the pictures here, so you don't have to worry much. So acyclovir, you should know that it's an antiviral drug, and as a summary, it works by what? Stopping DNA synthesis. Okay, so the virus needs to be forming DNA protein synthesis so that it can keep growing, it can keep making new copies of itself. So once this drug is able to stop DNA synthesis, it blocks what? The viral replication. So what's the class and mechanism of acyclovir? So first of all, you should know that it's a guanine nucleoside analog antiviral drugs. Okay. How does it work? When it gets into the body, it's like a prodrug, so it's converted into what? The active um, moiety. Okay. So the active moiety is what is known as what? Acyclovir monophosphate. I just want to keep a pillow on my laptop. I don't know if this would be nice. It's too close to me. So let me just manage it on my lap. So we said that it's converted to acyclovir monophosphate, which is the active moiety. So host cell enzymes will further convert it to acyclovir triphosphate. So two conversions, right? So this active form is what will now compete with DNA polymerase. It will go into the viral DNA. It will now terminate how the chain is being formed. Okay. So selectivity, only viral cells will activate acyclovir. Do you understand? So it will not affect the host cells, but it will rather what? Target only viral cells. Now moving, pharmacokinetics, absorption, bioavailability is low, distribution is widely distributed, protein binding is 9 to 33%, metabolism, minimal hepatic, elimination is through the kidneys, half-life is about 2 to 4 hours. So which type of disease conditions will you use acyclovir for? So herpes simplex virus infections, that's the type 1 and type 2. So things like genital herpes, herpes labialis, that's all those mouth herpes. Then also the varicella zoster virus infections, okay, like chickenpox, okay, shingles, that's herpes zoster. Then things like the herpes simplex virus, what encephalitis. Then sometimes you just give the drug in patients that you know that their immune system is weak, so that you can protect them against this disease condition. So adverse effects can cause nausea, diarrhea, headache, malaise, the normal adverse effect that every medical student used to sing out. Okay, so serious adverse effects which are rare can cause neurotoxicity, like cause confusions, tremors, and seizures. They sometimes can be toxic to your kidneys. Okay, that's nephrotoxicity. Can cause what? Crystalluria and renal impairment. So we are done with the first drug, which is what? Acyclovir. Okay, so pharmacology is quite fast. That's one thing I like about pharmacology. Now we'll be moving to the next antiviral drug, which we'll be discussing this evening. And the next antiviral drug which we'll be discussing this evening is known as the Adefovir dipivoxil. Okay, Adefovir dipivoxil. So we're actually going to discuss all the antiviral drugs that exist in the world, both the ones that are uh, always being used, like commonly being used, and also the ones that are rarely being used. You understand? So Adefovir will actually have the pictures here. You don't have to worry. I'll upload the videos, okay, on the pharmacology channel. So Adepovir dipoxil, just so you know, is an oral antiviral drug. Okay, sorry, viral drug. It's mostly used in the treatment of what? Hepatitis B virus infections. Okay, so some of these drugs you don't really see them commonly around because they are being developed to tackle just a single type of infection. Okay, so what's the class of this drug? Is a nucleotide analog reverse transcriptase inhibitor. That's the ones that they call the NTRTI. Okay, so mechanism of drug, adefovir dipivoxil is not an active drug, it's a prodrug. When you give it to a human being, it will be converted to adefovir only. So how does the adefovir work? So after oral administration, the adefovir dipivoxil will be converted to adefovir, which is what? Phosphorylated intracellularly, that's inside the cell. It will be converted to active metabolite, which is known as what? Adefovir diphosphate. So the metabolite is what will now compete with natural nucleotides. It will go into the viral DNA. It will now what? Terminate how the viral replication is going on. So they call that the chain termination. So this will inhibit what? The hepatitis B virus DNA polymerase. Okay? This will now reduce how the virus is making other copies of itself. Okay, so moving forward, pharmacokinetics, oral bioavailability is about 59%. Distribution is widely distributed, but there's low plasma protein binding. Metabolism is not significantly metabolized. Excretion is primarily what's through the renals. Okay, so half-life is about 7 hours. Okay, so therapeutic uses is used in treating what? Chronic hepatitis B virus infection. Okay, so it's sometimes using hepatitis B infections that were actually resistant to lamivudine. Okay, so most of the times people use lamivudine, they resist it, they have to opt in for this. It's not effective at on HIV. Okay, so adverse effects can cause asthenia, can cause headaches, can cause abdominal pains and diarrhea, can be toxic to your kidneys. Okay, can cause lactic acidosis, can cause enlarged liver, that's hepatomegaly, steatosis. Those ones are rare, do you understand? So I think we are done with the second antiviral drug. Remember, we are doing 50. 50, bro. Okay, so moving to the next antiviral drugs. Okay, so the next antiviral drug we should be discussing is what is known as what? The baloxavir mabozil. Okay, so it's usually nicknamed what? Zofluza. Okay, let's call the name again. Baloxavir mabozil. So you hear a lot of names of drugs, the ones that you never knew that they existed. Okay, but yeah, for real, they're actually there. So the baloxavir mabozil is actually a novel antiviral drug. It's used for the treatment of what? Influenza A and influenza B. Okay, so it's a prodrug. So that means if we give it, um, it will be converted to active, you know, components. Right? Hey, Vent Entertainment. Hey, bro, what's up, bro? What's up? Okay, so let's quickly talk about the drug. Okay, so it actually belongs to the antiviral type of drugs. Okay, it belongs to the class of what? Cap dependent endonuclease inhibitors. Okay, so what's their mechanism of action? Baloxavir mabozil, do you understand? Like it to be converted into what? Baloxavir acid. That means like if you give it to be converted to the active, metabolite, So this will now inhibit a subunit of influenza virus polymerase. Okay, this will now prevent a process known as cap snatching. That's a process where the virus hijack the host mRNA cap to initiate mRNA synthesis. Do you understand? So this will now inhibit replication, like it will stop how the virus is now making other copies of itself. Do you understand? So basically, so it will now reduce the virus from making other copies of itself. Do you understand? So it will reduce the viral load. So administration is oral, okay, single dose. Absorption is rapidly absorbed. Distribution highly protein bound. Metabolism, yeah, of course, it will be the baloxavir mabozil will be converted to baloxavir acid. Okay, so excretion is mainly through the feces. Okay, so pharmacodynamics. Well, once you give it and it's actually being able to what? Reduce the viral load. It will reduce the viral load. Okay, it's effective against influenza A and B. Shortens duration of symptoms because it is reducing how the virus is making other copies of itself. So, what are the different disease conditions that I can use this drug to treat? Influenza infections, okay, of course, we have been listing it so many times. So adverse effect is diarrhea, bronchitis, nausea, headache. Okay, there's sometimes, rarely, you have hypersensitivity reactions. Okay, so I think that's it, and we are done with the third antiviral drug. Okay, we're done with the third antiviral drug. So I'm just trying to reply someone. Okay, so we'll be moving to the fourth antiviral drug, which we'll be discussing this evening. All right, so the fourth antiviral drug we should be discussing this evening is what is known as what? Abacavir. Okay, so we're talking about the pharmacology of abacavir. Okay, all about drug and everything. Okay, the drug does and all of that. So abacavir, I have the picture right here. My screen, you don't have to worry. I'll upload it. Okay, on the pharmacology YouTube channel. So abacavir, as a way of introduction, you should know that it's a nucleoside reverse transcriptase inhibitor. Okay, so it's usually used in combination with other drugs, okay, mainly for treatment of HIV. So what's a full in-depth into the drug now? It's an antiviral drug. It's a nucleoside reverse transcriptase inhibitor. It's a guanosine analog. Okay, so let's look at how this drug actually works now. It goes into the cell. When it goes into the cell, it is converted to an active molecule or active moiety. Do you understand? This is what is known as a carbovyl triphosphate. Okay, so the active metabolites will now compete with natural nucleotides. It will go into the viral DNA. It will stop the virus from making other copies of itself. You say there's a chain termination. Okay, so this will now stop the HIV virus from making other copies of itself, which would have made the disease condition worse. Do you understand? So you're basically trying to halt that movement. So pharmacokinetics, absorption is rapidly absorbed and usually given the oral route. Distribution is widely distributed, can even go into the cerebrospinal fluid. Metabolism is via the liver, okay, via the alcohol dehydrogenase and the glucuronide transferase. Elimination is through urine. Half-life is about 1.5 hours. Now, therapeutic uses is mainly for HIV infection, okay? So you combine it with other drug, and that's what they call the antiretroviral therapy. They call it the ARTs, okay? So you combine it with other drugs like what? The lamivudine and the dolutegravir, okay? So that's what we got. So adverse effects can cause nausea, headaches, fatigue, rashes, then gastrointestinal upset, okay? Then rare adverse effects like what? Hypersensitivities. Okay, so that's what we have done with abacavir. So abacavir happens to be the fourth drug that we have discussed. Okay. Now we'll quickly look at another drug that is kind of like experimental. So this drug is known as what? The amenamevir. Okay, so when you hear all those abacavir, you know that this kind of like a member of those guys. Do you understand? So amenamevir is the next drug we look at. Okay, so the drug is actually a novel, is a drug that is still under study, but for literature's sake, we always talk about these drugs so that in future when they activate these drugs, you know that yeah, someone once spoke about them. Okay, so it's a novel non-nucleoside antiviral drug. It acts as a helicase primase inhibitor. It is developed for the treatment of what? Herpes infections, particularly the varicella zoster virus infections. We'll talk about the mechanism of action. So, talking about the drug profile in full, is a non-nucleoside anti-herpes virus agent. Okay. Mechanism: it inhibits the helicase primase complex. Okay, so this complex is very important for unwinding the viral DNA. So the process of unwinding the viral DNA is like you unboxing a gift. Okay, so that's what makes the virus to keep making copies of their self. So if you stop that process, so they said that by blocking the helicase primase activity, it will now prevent the virus from further making other copies of itself. Okay, so that's what we got. So let's move. So pharmacokinetics, absorption, you give it through the oral route and there's good bioavailability. Distribution is widely distributed. Metabolism is primarily what? Metabolized in the liver. Excretion is mainly via feces. Half-life is about 8 to 10 hours. So it's mainly used in Japan. Okay, then of course for countries that import things from Japan, they should also have they should also be using this. Do you understand? So the drug is still being investigated upon, okay, and it is showing what promises in use in treating herpes zoster virus infections, then herpes simplex virus infections, that's the type 1 and type 2. So adverse effects, you know, from studying a drug, you can know the possible adverse effects. So it can cause headache, gastrointestinal upset, mild rashes. Of course, they are testing these drugs on humans, but just that it's not open for use. Okay, so that's what we got for amenamivir. We'll quickly move to the sixth antiviral drug, which we'll be talking about this evening. Okay, so for the sixth antiviral drug, which we'll be talking about this evening, is a drug known as boceprevir. Okay, boceprevir is spelled Boceprevir. Okay, so let's talk about this drug and talk about how it actually works. So just so you know, it's a first generation, it's a direct acting antiviral drug, and it's mostly used in the treatment of hepatitis C virus infection. So hepatitis C virus infection. So let's look at the drug profile properly. So first of all, you should know that what is a direct acting antiviral drug. Okay, is an NS3/4A protease inhibitor. Okay, and the most popular brand name for boceprevir is what? Victrelis. Victrelis. So, what's the mechanism of action? It will inhibit the hepatitis C virus serine protease. That's the enzyme that they call the NS3/4A. Okay, so that enzyme is very important for the cleavage of viral polyproteins into functional protein. Like as the virus is growing, it's breaking up, then forming other copies of itself. That's the enzyme that makes the virus to break up and form other copies of itself. Okay, so if you stop that enzyme, you stop that virus from breaking up and forming other copies of itself. So by blocking the protease activity, it will prevent viral replication, okay, and it will prevent assembly of the infectious particles, okay. So pharmacokinetics is usually given orally and usually take it with food. Absorption, peak plasma concentration is reached in 2 hours. Distribution is highly protein bound. Metabolism is extensively metabolized in the liver. Excretion is mainly through the feces. Half-life is about 3.4 hours. Okay, so that's what we got. So, okay, basically, most of the times you combine the drug, okay, the boceprevir, you combine it with what? Pegylated interferon alpha and ribavirin. So, by combining it, you have more action on the hepatitis C virus. So clinical application is mainly used in treating what? Hepatitis C virus infection. Okay. Um, okay. Well, the drug is no longer commonly being used. Okay, but for literature's sake, we talk about every drug actively being used or not. So adverse effects can cause fatigue, anemia, nausea, headaches, and dysgeusia. That it will alter your taste. The way you are tasting things are not the same. Okay, so that's what we have for boceprevir. We'll quickly move to the next antiviral drug. Okay, and this one actually has a funny name. Okay, this drug is known as what? Asunaprevir. Okay, it actually reminds me of one Oxley song with Wandy Cole. As soon as I hold your waist. Okay, so Asunaprevir, okay, is the next drug that we'll be talking about. All right, so for this next antiviral drug, I actually have everything here, have the pictures, everything about this drug. Okay, so I'll be uploading it on the Pharmacology YouTube channel so that you guys will actually comprehend more. So just moving straight forward, the drug is just like the boceprevir that we just discussed. Do you understand? So it's a direct acting antiviral drug. This one too is used for hepatitis C virus infection. So to inhibit that enzyme that they call the NS3/4A protease enzyme. Okay, so so let's quickly move it. So it's an NS3/4A protease enzyme inhibitor. Okay, So it will block the hepatitis C NS3 protease. Okay, and that enzyme is very important for the virus to keep growing, break, and form other copies of itself. Okay, so when you inhibit the when you inhibit the enzyme, of course you inhibit the virus from making other copies of itself, so this will now lead to what? Suppression of the infection. The infection will no longer be moving freely like that. You understand? So let's quickly move. So pharmacokinetics, absorption is rapidly absorbed orally. Okay. Peak plasma concentration usually reached between 2 to 4 hours. Distribution is highly protein bound. Metabolism extensively metabolized in the liver via the cytochrome 3A4 system. So excretion is feces. Okay. Half-life is about 15 to 20 hours. So what's the therapeutic use? Most antiviral drugs, unlike the antibiotics that you see plenty infection, most antiviral drugs they just have a particular infection they handle. So this one is hepatitis C virus infection. Okay, I usually combine it with other drugs. Okay, like daclatasvir. Let me snap this. I don't think I covered this drug when I was talking about. Yup. Okay, so that's it for this. So adverse effects is just headache, fatigue, diarrhea, nausea. Then serious ones, it can damage your liver to the extent that it will cause elevated liver enzymes. Okay, so but that one is rare. It's rare. Okay, that's what we got. So let's quickly move to the next antiviral drug. Okay. If you join this live and you get tired, you can leave me. As for me, I don't get tired. I always work 50. Now we move to the next drug. This is what is known as a bictegravir. Bictegravir, you can see that most of the drugs in the same class, they end with like the same type of word. Okay, so vir, is spoken about a lot of drugs ending with vir. So bictegravir is the next drug which we'll get to discuss. And after this one, I think I should take like 2 minutes break. So first of all, you should know that the drug is a potent HIV integrase strand transfer inhibitor. We'll get to explain that. So you don't use it to only eat. You usually combine it with other what? Drugs that are used in treating HIV. And we call that what? The antiretroviral therapy. Hey, Akinyi Mary from Kenya. I see you, man. I see you for real. Okay, so the drug you don't usually give it alone. Okay, you usually join it with drugs like what? Tricitabine and the tenofovir, alafenamide. Okay, so usually combine it. So it's an antiretroviral agent. We usually combine it with those drugs. You hardly see it alone. Usually combine, and when you combine it, the brand name goes with what? Biktarvy. Okay, it's just like that. So it inhibits the HIV-1 integrase enzyme. Okay, specifically the strand transfer of viral DNA integration into the host genome. Okay, so to now prevent stable incorporation of viral DNA, this will now halt replication. It will stop the HIV virus from making other copies of itself. Do you understand? So basically, HIV virus will rarely resist this one. Do you understand? So pharmacokinetics, you give it orally and it's usually administered once daily. Absorption is rapid. Okay, distribution is highly protein bound. Okay, metabolism is via the UGT 1A1. Okay, excretion is 60% via feces, 35% via urine. Half-life is about 17 hours. Okay, then so pharmacodynamics, it provides potent suppression of the HIV RNA. Okay, but that's where you combine it with what? Tricitabine, like we spoke about, and a tenofovir alafenamide. Okay, so that's what we got. So clinical indications, like which disease conditions you use this drug for, just like we've been talking about. So HIV-1 infection. Remember there's a HIV-2. Okay, so use this one for HIV-1. Okay, so you can use it in adults and also children that are more than 2 years. So adverse effects can cause headaches, diarrhea, nausea, and fatigue. Okay, then hepatotoxicity. Okay, so let me just reply some messages on WhatsApp before we continue. Okay, so I think I don't really have much messages. So let's quickly move to the next antiviral drug, which we'll get to discuss. All right. So for the next antiviral drug, which we are discussing, we're talking about a drug known as what? Atazanavir. Atazanavir. Okay. Atazanavir. So I have the pictures here, everything. Okay. I'll upload it, alright, so that you guys you get to see. So atazanavir, you should know that it's an antiretroviral drug. Okay, so it's a member of a type of antiretroviral drug. Antiretroviral drug, that's like HIV drugs. So it's a member of the HIV drugs that collectively they call them the protease inhibitors. So usually combine them with other drugs, okay, used in treating HIV. Hey Kanye, hey Kanye. Alright. So it works by blocking the HIV-1 protease enzyme. We'll get to talk about the importance of what? The HIV-1 protease enzyme. So, class, that's looking at the profile of the drug properly. Okay. So, HI is a HIV-1 protease inhibitor. Mechanism, it binds to the active site of the what? HIV-1 protease. Okay. This will now inhibit the cleavage of the GAG polyprotein precursors. This will now prevent formation of functional viral proteins. If there's cleavage of the GAG polyprotein precursors, that's what will now make the virus form other copies of itself. Do you understand? So this will now resist the virus from making other copies of itself. So it will now lead to what? The virus having immature, like the HIV is not making other copies of itself, so it will force the infection to kind of like halt. Okay. So pharmacokinetics, oral bioavailability increases when you take food. So you should note some drugs you don't take them with food, or you take the food after some time. Some drugs you still have to take food. So distribution is highly protein bound. Metabolism is in the liver. Excretion is mostly through the feces. Okay, so half-life is about 7 hours. Hey Nestor Favor. Hey Charles Geke. What's up, guys? What's up, guys? Okay, so therapeutic uses. Okay, I've told you guys most antiviral drugs are tailored towards a particular disease condition. So it's used in treating HIV-1 virus in adults and also children. So they often combine it. So you often combine it with what? Ritonavir, okay, which is a very popular antiviral drug. Okay, so I think the adverse effect is nausea, diarrhea, and headache, and rashes. Okay, then can also elevate bilirubin levels. That's what we call the hyperbilirubinemia. Okay, so we'll quickly move to the next antiviral drug. Okay, so it's loading. All right, so now for the next drug which we'll get to discuss, it's pharmacology. Is what is known as enfuvirtide. This one is a very popular antiviral drug. Enfuvirtide. Okay, enfuvirtide. So it's usually called fusion. Okay, fusion. So for enfuvirtide, just so you know, it's an antiretroviral drug. When you say a drug is an antiretroviral drug, it's used in treating HIV. Okay, so it's used in the treatment of HIV-1 infection. It is unique as the first and only fusion inhibitor. When you search uh, fusion inhibitor types of HIV drugs, you see just enfuvirtide. So they found only it and they haven't found a replacement. So it's approved for HIV therapy. It acts at the stage of the virus trying to enter the cell. Let me explain something. As the virus is trying to enter the cell, it first of all gums on the cell membrane, okay, before it goes in. So this one is a fusion inhibitor, meaning it will stop the virus from even binding on the cell, okay? So looking at the drug profile properly, is a HIV-1 fusion inhibitor. So enfuvirtide binds to the GP41 subunit of the HIV envelope glycoprotein. It will now prevent some changes that would have come in that would have made the HIV virus to be able to bind to the, what do they call it, to the cell membrane. Do you understand? So this will now block the HIV from entering the CD4 T cells, which are very important for your immune system. So it will halt the infection even at the point of entry. So it's a fusion inhibitor. Okay, so it's very good drug, right? So pharmacokinetics, they usually give it through injection, and the injection is under the skin. They call that a subcutaneous injection. Absorption, peak plasma concentration in about 4 to 8 hours. Distribution is widely distributed. About 92% will be protein bound. Excretion, peptide fragments, they are eliminated via the renal pathways. Okay, so half-life is about 3.8 hours. Okay, so therapeutic uses, just HIV-1 infection, but it's actually life-saving. Okay, so it's always used in combination with other drugs. So as you are giving this drug that have this particular mechanism, you are giving another drug that has another particular mechanism and all of that. So adverse effect is just you give it under the skin, so sometimes you can have reaction at the site of injection, like pain, erythema, nodules. Okay, so sometimes the patient might feel weak, sometimes the patient might have some troubles sleeping and all of that. Okay, so it's actually a very nice drug. So we'll move to the next antiviral drug, and oh, 50, we're going 50. So for the next antiviral drug, we'll talk about what is known as M3citabine. M3citabine. So for the M3citabine drug, we'll talk about its pharmacology. So it's an antiretroviral drug. It's widely used in the treatment of HIV-1 infection. Okay. Okay, so let's look at the drug profile properly. So it's a nucleoside reverse transcriptase inhibitor. M3citabine is phosphorylated when it gets into the cell, okay, so that it becomes an active form. Like the drug is given in a prodrug, so it has to be activated. So this activated form is known as a triphosphate form. So this metabolite will compete with natural nucleotides and to incorporate into the viral DNA. Okay, so you have a strange thing coming into the viral DNA, so it will stop the virus DNA from what? Forming other copies of itself. So you see there's a chain termination. Okay, so it's structurally similar to lamivudine, that's just an adage. Okay, so pharmacokinetics, oral bioavailability is about 93%. Okay, distribution is widely distributed. Metabolism is in the liver, but minimal. Excretion is mainly through the urine. All right. So half-life is about 10 hours. Okay. So it's used mainly in treating HIV-1 infection. Okay. You can also give it as prophylaxis. That's like you are giving it before time. So before time to handle any possible infection that could come up. So it can also be used in treating hepatitis B virus infections. Okay, that's just by the way. So adverse effects can cause headaches, can cause diarrhea, can cause nausea, can cause rashes. Okay, but that one is rare. Can also cause lactic acidosis. Can also cause what? Um, Enlarged liver. Okay, can also cause enlarged liver. Okay, can also cause enlarged liver. So that's what we got. Okay, that's what we got for emtricitabine. Okay, so we'll quickly move on to the next antiviral drug we should be discussing. Okay, plug my system. Now, for the next antiviral drug, this is what is known as the Amprenavir. Amprenavir. So we get to talk about the pharmacology of this Amprenavir, okay, and make a lot of sense out of it. So for the drug Amprenavir, we said that is a drug. Okay, so it's a HIV drug. So HIV drugs have classifications, and this classification is based on how they work. So this one is a protease inhibitor. Okay, so it's used in treatment of HIV. Okay, so let's look at the drug profile. So the HIV-1 protease inhibitor. Okay, how does it work? It will bind to the active site of HIV-1 protease. Anything ACE is an enzyme, right? So this will now prevent the cleavage of GAG and polyprotein precursors. Once those polyproteins are not being able to cleave, okay, it will now result into, yes, the virus can be making copies of itself, but it will never mature. Do you understand? So you have immature copies of virus being formed, and they are non-infectious. Of course, if the virus is not mature, it can cause issues to you. Okay. So pharmacokinetics, absorption is orally given, you know, and when you take food and you take this drug, can actually tend to like reduce how the drug will act. Distribution is highly protein bound, metabolism is in the liver, excretion is through the feces. Okay, half-life is about 7 to 10 hours. So it's mainly used in treating HIV infection in adults and children. Okay, so adverse effects can cause nausea, diarrhea, rashes. Okay, then sometimes lipodystrophy, then sometimes hyperlipidemia. Okay, then also insulin resistance can also be a thing. Okay, which could be a problem when taking this drug. Let's quickly move to the next antiviral. Okay, antibiotics have actually gone so much in my mouth. Okay, now for the next antiviral drug we should be discussing is what is known as etravirine. Okay, etravirine. Okay, so for the etravirine, I got it. We'll talk about this drug. So it's an antiretroviral drug. Okay, anytime you hear antiretroviral, it's actually used in treating HIV. Okay, so it's actually used in the treatment of HIV-1 infections, and it belongs to a class of drug known as the what? Non-nucleoside reverse transcriptase inhibitors. So they call them the NNRTIs. NNRTI. Okay. So how does these drugs work? They bind to the HIV-1 reverse transcriptase. That's an enzyme. Okay. And this will stop the enzyme from changing to a form okay, that will make it active. Are you getting it? Like it will stop the some enzymes when they want to become active, they change the particular shape and all of that. So this will stop the enzyme from what? Changing. They call it will inhibit conformational changes. So this will now prevent what? The enzyme from doing its activity. What's the activity of the what? Reverse transcriptase. The activity is to turn viral RNA to DNA. So if you stop that activity, it will stop the virus from making other copies of itself. So that's what we got for this. Okay, so pharmacokinetics is usually given orally, is highly protein bound, extensively metabolized in the liver, excretion is mainly through the feces, half-life is about 30 to 40 hours. Okay, so therapeutic uses is mainly used in treatment of what? HIV-1 infection in adults and also children, but these children must be more than 6 years. Okay, so it's always used in combination with other antiretroviral drugs. Okay, so in as much as it is effective, you always combine it with other drugs so that it will further even make it more effective. So adverse effects can cause rashes, nausea, diarrhea, headaches. Okay, then serious ones can cause the Stevens-Johnson syndrome and a toxic epidermal necrolysis. Okay, which are basically rare. Okay, now we'll quickly move to the next antiviral drug. All right, quickly move to the next antiviral drug. Let me turn off my switch. Now, for the next antiviral drug which we'll be discussing is what is known as a delavirdine. Okay, delavirdine. Okay, delavirdine. Okay, so for the delavirdine, I actually have all the structures and pictures right here. So it's a non-nucleoside reverse transcriptase inhibitor. Okay, it's mainly used in the treatment of HIV infections. Okay, so it's usually marketed under the brand name known as what? The Rescriptor. Okay, Rescriptor. Okay, so how does it work? It binds to the HIV-1 reverse transcriptase. That's an enzyme. Now it will bind with at a site, okay, and this site will stop that enzyme from becoming active. So the role of that enzyme will not be accomplished. Now, what is the role of that enzyme? Is to convert RNA to DNA. Okay, so by stopping that, of course, you are stopping the virus from making other copies of itself. So absorption is rapidly and usually given orally. Distribution there's limited penetration in saliva, semen, and cerebrospinal fluid. Metabolism is through the cytochrome enzymes known as the 3A4 and the 2D6. Excretion is mainly feces. Half-life is about 5 to 11 hours. Okay, so of course, by stopping the virus from making other copies of itself, it's reducing the viral load and further strengthening the immune system. So clinical application is used for HIV virus infections only. Okay, adverse effects could include rashes, headaches, nausea, and fatigue. That's body weakness. Okay, you can also have the Stevens-Johnson syndrome and toxicities to the liver. Okay, so that's a delavirdine. We just spoke about it. We'll quickly move to another investigational drug. Okay, so for this investigational drug, what we have here is the Lanivir octanoate. Okay, Lanivir. Okay, so it's Lanivir octanoate. Okay, so it's actually an investigational drug. So just like I told you guys, for educational purposes, we discuss both drugs that are in active use and also the ones that are still being worked on. So laninamivir octanoate is just a long-acting prodrug of what? Laninamivir. So sometimes, if some drugs are just easily being destroyed in the system, they could actually repackage them and um, make what other versions of it, okay, that can be resistant to that destruction. So it's a drug that falls under the class of antiviral drugs known as what the neuraminidase inhibitors. So they are used for the treatment of what influenza A infections and influenza B infections. Okay, so it's an antiviral agent, belongs to the neuraminidase inhibitor classes. Okay, so it's actually a prodrug of the laninamivir itself. Okay, so mechanism of action. Uh, what is a prodrug? So when it gets into the system, it gets converted to the active moiety, which is the laninamivir itself. Okay, so laninamivir binds to the active site of influenza neuraminidase. This will now block the enzyme that cleaves what salicylic acid residues from the host cell receptors. This will prevent the release of what newly formed copies of virus known as the virions. Do you understand? So to stop the virus from making what other copies of itself, thereby reducing the intensity of the infection. So administration is inhaled via dry powder. Okay. Absorption is usually in the respiratory tract. So this one is what? Inhalational route. Now, distribution is usually in the airways. Okay. Metabolism, it will be converted to the what? Laninamivir itself. Okay. So think basically that's it. So clinical application is mostly used in Japan for treatment of influenza A and B virus. Okay. Used as is influenza virus infection is usually a respiratory tract infection. So some common adverse effects is cough, wheezing, headaches, then nasopharyngitis. Okay, so on rare occasions, it really cause some complications in patients that already have asthma or chronic obstructive pulmonary disease. Okay. Now, quickly trying to move to the next antiviral drug. Okay, now for the next antiviral drug which we'll be discussing, this is what is known as a darunavir. Darunavir. Okay, so for the darunavir, you should know that it's a second generation HIV protease inhibitor. So they usually combine it with other drugs in treatment of HIV-1 infections. Okay, so it's an antiretroviral agent. It falls under the category of HIV drugs known as protease inhibitors. Okay, so it's marketed under several brand names like the Prezista, Prescobix, the Result Star, okay, the Sintuza. All of these are brand names for what? Darunavir. So how does this drug work? Okay, so it's a protease inhibitor. So you should know that it actually binds to the HIV-1 protease enzyme. So the enzyme is very important in cleaving polyproteins for them to become functional. Okay, so that other copies of the virus is being formed. Okay, so by blocking the protease enzyme activity, it will prevent the formation of new copies of the virus, okay, that will be infectious. So it will actually reduce what? The viral load, okay. So absorption is orally, distribution is highly protein bound, metabolism is in the liver, okay. Excretion is mainly through the feces, okay. Half-life is about 15 hours. That's what we got. So pharmacodynamics, it actually suppress what? HIV replication. To suppress HIV replication. Okay. So it's effective in treatment. Okay, so it's used in treatment of for HIV. That's in adults and also children that are more than 3 years. So usually combine it to other antiretroviral drugs so that basically to make it more effective. So adverse effects is diarrhea, nausea, headaches, rashes. Serious ones could cause toxicity to your liver. Then sometimes you have some skin reactions. Okay, so that's it for darunavir. Quickly move to the next antiretroviral drug. Okay, antiviral. Okay, it's antiviral, antiretroviral, anyone. Now, for this drug, what we got here, the name is what is known as what? The doravirine. Okay, doravirine. So for this drug known as a doravirine, we have it here. We'll talk about its pharmacology. So as a way of introduction, the drug belongs to a class of drugs known as a non-nucleoside reverse transcriptase inhibitors. Okay, so when we talk about how they function, you guys should get to understand it and appreciate it better. Okay, so they usually combine this drug with other drugs, okay, and they use it in treating what? HIV infections. So it's actually what? A non-nucleoside reverse transcriptase inhibitor. Is a pyridinone derivative. It will bind to the HIV-1 reverse transcriptase. Okay, so it will now cause what? Non-competitive inhibition of the enzyme. So it will block what? The enzyme from turning RNA into DNA. Okay, so that will basically what? Stop the virus from making other copies of itself. So unlike nucleoside analogs, it does not require phosphorylation and does not incorporate into the viral DNA. Okay, it rather attacks the enzyme, okay, rather than the DNA itself. So it does not attack human cells, it only attacks what? The cells of the virus. Okay, so pharmacokinetics is rapidly, the absorption is orally. Okay, Obiora, what's up, bro? Obiora, what's up? So bioavailability is not affected by food. Okay, distribution, it binds to proteins, okay, but moderate. So metabolism is in the liver and is usually excreted in feces, okay, for this drug. So half-life of this drug is about 15 hours. So the drug is actually approved for treatment of HIV-1 infection in adults. Okay, HIV-1 infection in adults. So usually sees other brand names like the Pifeltro and the Delstrigo when they combine it with what? Lamivudine and the tenofovir disoproxil fumarate. So adverse effects can cause nausea, dizziness, headaches, fatigue, then some stomach pains. All right. So that's what we got for the doravirine drug. Okay, we'll quickly move to the next one, which we'll be discussing. Okay. So, for the next drug, which we'll be discussing, sorry, let me turn my AC to face down. Okay, so take my laptop is needing some cold. Now, for the next drug, which we'll be discussing, that's the next antiviral drug which we'll be discussing, is what is known as what? The didanosine. Didanosine. Okay, so for didanosine, just so you know, it's a drug used in treating HIV. Okay, so it belongs to the class of drugs known as what? The nucleoside reverse transcriptase inhibitors. Okay, nucleoside reverse transcriptase inhibitors. Okay, so it's a purine analog. Inside the cell, it will be converted to the active moiety. So the active moiety is what? The D-Day oxyadenosine triphosphate. So to compete with natural, that's the active moiety, it will compete with natural nucleotide, it will incorporate into the viral DNA. This will now cause what? Premature chain termination, like it will stop the virus from making um, other copies of itself. Do you understand? So it's selective for viral replication. Do you understand? That's to tell you that it will not attack human cells, okay? To only attack the viruses. So the Dano saying pharmacokinetics, absorption is orally, distribution can go all around, including into the cerebrospinal fluid. Metabolism is via the liver, excretion is via the renals, okay? Half-life is about 1.5 hours. So it's mainly used in treating HIV infections, okay? It's mainly used in treating HIV. So adverse effects can cause diarrhea, nausea, abdominal pain, and headaches. Then we have some rare adverse effects there, like pancreatitis and peripheral neuropathies. So that's it for the danosine. All right, so I think I actually turned my AC to face my laptop because it was actually getting hot. So me now, I'm getting cold. So I think let me get my blanket. Let me get my blanket because this work, I must finish it this night because tomorrow we have another work. Okay, you can't push the work of today to tomorrow. Okay. Let me get water too. I was actually feeling thirsty too, so get some water. Bro, this AC is making me cold now. Yeah. Bro, work must go on. Do you understand? At the expenses of any condition, at the expense of anybody. My laptop has stopped being hot, but I think I should still leave it for a while. Okay, so we'll move to the next drug. Okay. Now, the next antiviral drug we should be talking about is what is known as Fomsamprenavir. Are you getting the name? It's what is known as Fosamprenavir. Okay, so let's quickly look at this. Now, for the Fosamprenavir, I know this drug. Okay, I actually know it as prodrug. Okay, prodrug in the sense that it will be converted to the active drug. Okay, later on. So it's an antiretroviral drug. Okay, so it's used in treating what? HIV infections. Okay, so just like I told you guys, it's a prodrug of amprenavir. So that means if I give Fosamprenavir to you, later on it will be converted to what? Amprenavir. Okay. So what's the drug profile for this? It's a HIV-1 protease inhibitor. Okay. So the Fosamprenavir will be what? Hydrolyzed, like it will be converted to amprenavir. That's later on where you give it through the oral route. So it will bind to what? The HIV-1 protease enzyme. Okay, so it now prevents the activities of the enzyme. What's the activities of the enzyme? It's for cleavage of GAG and GAG polyprotein precursors. So if you prevent that cleavage, yes, the virus will be making other copies of itself, but those copies will never get matured. They will remain immature, and immature copies of the virus are non-infectious. Okay, so the virus is now harmless to you. So pharmacokinetics, absorption is usually given orally, and there's a good bioavailability. Okay, and they actually made this a prodrug because the original Antiviral was kind of like having minimal effects. Distribution is highly protein bound. It will be converted to Antiviral. Okay, excretion is primary what fecal elimination. Half-life is about 7 to 10 hours. So therapeutic uses is used in treating what HIV-1 infections in adults and also children. Okay, so they usually combine it with other drugs. So adverse effects can cause nausea, vomiting, diarrhea, rashes, headaches. Metabolic effects can cause lipodystrophy and hyperlipidemia, but those ones are kind of like rare. Then insulin resistance too. Okay, so that's it for Fosamprenavir. Okay, so quickly move to the next drug. But let me reply someone. All right. So we'll quickly be moving to the next drug, and for this next drug right here before us, that's right before our screen, is a drug known as what? Entecavir. Pharmacology of Entecavir. Okay. So we'll talk about Entecavir, how it works, applications, and all of that. So Entecavir, as a way of introduction, just so you know, is an oral antiviral drug. It's used in the treatment of what? Chronic hepatitis B virus infections, mainly. Okay. So let's quickly look at its profile. So it's a guanine what nucleoside analog. Okay. So how does it work? It's inactive. So when you give it to someone, um, okay, can I have my Instagram? Sorry, I'll type my Instagram using another account, right? So I'll type my Instagram using another account. So please, I'm typing my Instagram now. Sorry, I'm typing something for someone. I type it. That's still me. All right. That's still me. Okay. So entecavir will be phosphorylated. That means it will be converted to its active type. Okay. So the active form is the triphosphate form. So it will work by what? Inhibiting the hepatitis B virus DNA polymerase, okay, by blocking the base priming. Okay, so this will now prevent what? Reverse transcription of the negative strand. Okay, so it will inhibit what? Synthesis of the hepatitis B virus DNA. All right, so pharmacokinetics, oral bioavailability is about 100%. Distribution is widely distributed. Metabolism is minimally metabolized. Half-life is about 128 hours to about 149 hours. Okay, so therapeutic uses is used in treating hepatitis B virus infections. That's both in adults and also children. Okay, So, but for the children, they have specifications. Children are more than 2 years. Okay. So, adverse effects can cause headaches, can cause fatigue, can cause dizziness, can cause nausea, can cause lactic acidosis, can also cause um, lactic acidosis. Okay. All right, bro. Okay, okay. I'll be waiting for a message. So, but really trying to move to the next antiviral drug. Okay, moving to the next. Okay, moving to the next antiviral drug. So for the next antiviral drug we should be discussing, we'll be talking about a popular drug, and this is what is known as what? The dolutegravir. Dolutegravir. Okay, dolutegravir. Now for the dolutegravir antiviral drug, just so you know, is a modern antiretroviral drug. Okay, it's an antiviral drug but used in treating HIV. So you say antiretroviral. Okay, so is a member of the what integrase strand transfer inhibitors. When we talk about this mechanism of action, you guys will get to understand better. So how does this drug work? Okay, how is it an integrase strand inhibitor? It binds to the active site of an enzyme known as a HIV integrase. So this will now block what? Strand transfer step of integration. This will prevent the viral DNA from inserting into the host genome. This will now halt what? The HIV from making other copies of itself. Okay, so it has a high genetic barrier to resistance, meaning most HIV virus types can rarely resist it. So pharmacokinetics, there's rapid oral absorption, bioavailability is not affected by food, distribution is highly protein bound. So metabolism is via the UGT1A1 glucuronidation. Elimination is mainly feces. Half-life is about 14 hours. Okay, so you dose it once daily. So therapeutic uses is used in treating HIV-1 infections. You see it in different brand names like TVK, you have the Triomec, you have the Dovato. Okay, so adverse effects can cause insomnia, can cause headaches, fatigue, gastrointestinal upset, can cause depression, anxiety, and dizziness. All right, so I think that's it for that particular drug. We'll quickly move to the next drug, which we'll be talking about. It's pharmacology. Now, for the next drug, which I'll be looking at, is pharmacology. Um, I need to prepare a technological process for one subject on the producer Cephalosporum aquemonium. That is for the cultural medium for the final product. Can you help? Message me on Instagram, bro. Message me on Instagram. Hey, Ollie, what's up, bro? Ollie, what's up? I see you, bro. Message me on Instagram. Message me on Instagram. Okay. Now we'll quickly move to the next drug, and for this one is known as ibalizumab. Okay, ibalizumab, UIYK. Ibalizumab, UIYK. Okay, so they usually nickname this drug the Trogarzo. Okay, the name is heavy, right? Okay, so I have the pictures right here and all of that. So the drug, he said that it's a CD4 directed post-attachment HIV-1 inhibitor. Okay, so you usually use it in combination with other drugs in treating HIV-1 infections. Okay, so how does it work? It's a HIV entry inhibitor. That means to stop the HIV virus from even entering into the cell. Okay, and to stop the HIV virus from even entering into the cell. So it binds to the domain 2 of the CD4 receptor on the T cells. Okay, so this binding causes a conformational change that blocks what? HIV-1 GP120 from interacting with co-receptors. Okay, so unlike other entry inhibitors, it does not interfere with the normal CD4 receptor function. So what's the result? It will prevent the virus from entering into the host cell. Do you understand? The virus will attach, but it will prevent it from further entering into the cell. Do you understand? So that's just this drug works. So, so pharmacokinetics usually give it through the veins, intravenous. Distribution is through the veins. Okay, so absorption. So distribution has a long half-life, about 3 to 3.5 days. So you just give it twice a week. Okay. Metabolism is via the proteolytic pathways. So indications is mainly used in treating HIV-1 infections. So they always use it in combination with other drugs. Okay. So what's the adverse effect? It can cause diarrhea, can cause dizziness, can cause nausea, can cause rashes. Okay. So that's what we got for ibalizumab. We'll quickly move to the next antiviral drug. We're gradually coming to an end, right? Gradually coming to an end. Now, for this drug, this is what is known as a grazoprevir. Grazoprevir, okay? So for the grazoprevir drug, let's look at its pharmacology. So it's a direct-acting antiviral drug. That means it's okay, directly. We'll talk about more of it in the mechanism. So it's used in the treatment of hepatitis C virus infections. Okay, so how does it work? It blocks a very important enzyme known as the NS3-4A protease enzyme. So it is known as the NS3-4A protease inhibitor. Okay, so when it inhibits that enzyme in a hepatitis C virus, the enzyme is very important, okay, for the virus to keep forming, to keep what? Turning polyproteins into functional proteins, okay? So once you block that enzyme, it will prevent the virus from forming functional proteins. So in that way, it will stop the virus from what? Making copies of itself. Do you understand? So this will now lead to what? Suppression of the hepatitis C virus infection. So pharmacokinetics, they usually give it orally, and bioavailability will increase with food. Distribution is highly protein bound. Metabolism is in the liver. Excretion is mainly through the feces. Half-life is about 31 hours. Okay. So therapeutic use, they use it in treating hepatitis C virus infection, especially the chronic ones, you know. So it's commonly used in fixed dose combination with what? L-Bazvir. That's what's known as Zepatia. Okay. So it's effective in patients with compensated liver disease. Okay. So adverse effects is fatigue, headache, and nausea. Okay. Then sometimes they cause a lot of damage to your liver, all right, leading to elevated liver enzymes. Okay, so let me just quickly look at something. Let me just quickly look at something. Sorry, a minute, please. Feeling so cold, nigga. But my laptop actually need the AC. Do you understand? My laptop needs the AC, so that's why I'm actually having a blanket on. Bro. All right, so let's quickly move to the next antiviral drug. Okay. Now, for the next antiviral drug, which we'll get to discuss, is pharmacology. This is what is known as a cabotegravir. Okay, cabotegravir. All right, cabotegravir. So, for the cabotegravir, um, we said that it's a long-acting HIV integrase strand transfer inhibitor. We'll get to explain everything in detail, right? So, the drug class is an antiretroviral agent. That means it's used in treating HIV infections, especially the HIV-1 infection. So, it's integrase strand transfer inhibitor. Okay, so it has popular brand names like the Vocabria. We have the Apretude. So, mechanism of action: it will inhibit the HIV-1 integrase enzyme. The enzyme is responsible for inserting the viral DNA into the host genome. Like, it will connect the viral DNA into the host genome, thereby hijacking the host genome. Do you understand? So when you block the enzyme, you are blocking that transfer step. Okay, so you are ultimately preventing what integration of the HIV DNA into the host genome. Okay, so administration is usually oral tablets, okay, or intramuscular injections. Absorption is oral bioavailability is good. Distribution is highly protein bound. Um, metabolism is via the UGT 1A1. Okay, excretion is via the feces. Okay, then urine too. So half-life is about 41 hours. That's for the oral tablets. Intramuscular injection is about 5.6 to what? 11.5 weeks, right? So it provides potent suppression of the HIV replication. So it's long acting. Okay, that's the injectable one, where we're saying the half-life is about 5.6 to 11.5 days. So it's actually long acting. So clinical application is using what? HIV treatments and also HIV prevention. Okay, so adverse effects, sometimes when you give the injection, you can have swellings at the injection site or pain. Okay, sometimes headache, fever, fatigue. Okay, so I think that's what we got for the cabotegravir. We'll quickly move to the next antiviral drug. Okay, and for the next antiviral drug, we have what is known as dasabuvir. Okay, dasabuvir. So for the dasabuvir, we have it here. So that's a direct acting antiviral drug. Okay, direct acting antiviral drug. Okay, it's a direct acting antiviral drug. So it's usually used in combination with other drugs. Okay, used in treatment of what hepatitis C virus infection. Okay, so it's a direct acting antiviral drug. It's a non-nucleoside type polymerase inhibitor. So how does it work? Um, it targets the hepatitis C virus enzyme. Okay, the polymerase enzyme. That's the enzyme that is very important for the virus to keep making copies of itself. So when you target the enzyme, okay, sorry, um, I actually made a mistake. So when you target the enzyme and you block it, of course, that will now terminate, okay, the virus from making copies of itself. So it will prevent replication of what other copies of the hepatitis C, okay. So thereby it will reduce what the viral load. So that's how Buvir is usually given orally, and bioavailability is enhanced when you take it with food. Distribution is highly protein bound. Metabolism is via the cytochrome 2CA enzymes and the 3A enzyme. So excretion is mainly via feces. Half-life is about 5.5 to 6 hours. Okay, so it's usually active against the hepatitis C virus infections. So clinical use is usually combined with other drugs, okay, and they use it in treating hepatitis C virus infections, okay. So they combine dasabuvir or betazvir, the paritaprevir, and the ritonavir, and together they call that the Vicara Pack regimen, okay. So what's the adverse effects? Can cause fatigue, can cause nausea, can cause insomnia, can cause pruritus. Okay, so serious adverse effect can actually be toxic to your livers too. All right, so that's what we got for the dasabuvir. Okay, dasabuvir. We'll move to the next antiviral drug right here. Okay, so this one is kind of like an investigational antiviral drug. Okay, so the drug right here before us is an investigational drug. That's to tell you that it's not fully in use yet. So this one is known as, well, what is known as a Senicriviroc. Okay, pharmacology of Senicriviroc. Okay, so Senicriviroc is what we got here. I have all the pictures here. You don't have to worry about it. I'll upload. So it's an investigational oral drug, and it acts as a dual what antagonist of receptors. That's, it will block those receptors. So those are the what CCR2 receptors and the CCR5 receptors. Okay, so we'll talk about it. So mechanism of action. The CCR5 antagonism, that's blocking the receptor. It blocks the HIV-1 entry into the cell by preventing the GP120 from interacting with the CCR5 receptors. Okay, how about the CCR2 now? It will inhibit monocyte and macrophage recruitment to sites of inflammation. So that will reduce what? Fibrosis. Okay, so it functions as well as both blocking the entry of the virus into the cell and also reducing the effect that the virus will have on you when it eventually gets into the cell. So it's usually given orally, good oral bioavailability. It's metabolized in the liver. Excretion is mainly through the feces. So half-life usually give you once in a day. Okay. So pharmacodynamics, of course, as it is acting dually, it will reduce viral load. Okay. So it's used in liver infections. Okay. Used in treating liver fibrosis. Okay. It's used in treating HIV infections. Okay. Then that's just what we got. So adverse effects is headache, fatigue, nausea, diarrhea. Okay. They sometimes can damage your liver, leading to elevated liver enzymes. Okay, so quickly move to the next drug. Now, um, the next drug we have before us is quite popular. Okay, next drug we have before us is quite popular, and this is what is known as a foscarnet. Okay, foscarnet. Okay, foscarnet. So we'll discuss the pharmacology of foscarnet. We'll try to make um, as much sense as we can. Now, it's an antiviral drug. It's used in treating a lot of viral infections, okay, including cytomegalovirus infections, then herpes simplex virus infections, okay. So, what's the class of drug? It's an inorganic pyrophosphate analog, okay. So it's an antiviral agent. It will bind to the pyrophosphate binding site of the viral DNA polymerase, also the RNA polymerase, and the HIV reverse transcriptase. It is actually what inhibiting three enzymes. So it will block the cleavage of pyrophosphate from what deoxynucleotide triphosphate. So the whole thing will be what will halt DNA elongation. Okay, do you understand? So pharmacokinetics usually give it through the veins. That's intravenous. Okay, it's intravenous route. So it's widely distributed. It will even cross the cerebrospinal fluid. Now, it's not metabolized. It remains unchanged as it goes through your system. So excretion is mainly through urine. Okay. So half-life is about 3 to 7 hours. Okay, half-life is about 3 to 7 hours. So indications is used in treating cytomegalovirus infections, then herpes simplex virus infections, okay, and all of that. Then cytomegalovirus retinitis. Okay, so adverse effect can cause nausea, vomiting, diarrhea, headaches, can be toxic to your kidneys, can also cause electrolyte um, imbalance or disturbances, so to say. Okay, so that's what we got for foscarnet. Okay, for the next antiviral drug, the next antiviral drug which we'll get to discuss is what is known as the fos fos temsavir. Okay, fostemsavir. Okay, so fostemsavir actually goes with a very popular brand name, which is known as the Rucobia. Okay, Rucobia. Now, for this fostemsavir, we said it's a novel antiretroviral drug. Okay, so it's used in treatment of HIV-1 infections in particular. Okay, particularly in heavily treatment experienced patients that have HIV that has been resisting a lot of drugs. So for HIV resisting a lot of drugs, you introduce this guy. Now, what is a class of drug? It's a HIV-1 attachment inhibitor. Okay, so it will be converted to temsavir, which is like the active form. So temsavir will be what will bind to GP120 subunit of HIV-1 envelope glycoprotein. So this will prevent some conformational changes that are actually required for the virus to attach to the CD4 receptors on the host T cells. Okay, so the result is this: HIV will not be able to enter into your CD4 cells. Now, your CD4 cells are actually very important for your immune system. Izzy, what's up now? Izzy, what's up? I came to Jaws. There's so much cold, bro. Okay, so you see that the HIV will not be able to enter into the CD4 cells. So HIV not being able to enter into the CD4 cells will not be able to affect your immune system. Okay, so it will not be able to infect, and also your immune system will be strong on the other side. So pharmacokinetics, absorption usually orally. Okay, distribution is highly protein bound. Okay, metabolism, it will be converted to the active form. So the active form is a term Savir. Okay, so excretion is mainly through the feces. Okay, half-life is about 11 hours. Okay, so it's mainly used in treating HIV-1 infections in adults. Okay, so adults, this one is not for pediatric use. So adverse effects is nausea, diarrhea, headaches, abdominal pains. Okay, so that's what we got for the first term Savir. Now we'll quickly try to move to the next antiviral drug. Quickly try to move to the next antiviral drug. And what we have here is loading. What we have here is a drug that is known as what? Idozuridine. Okay, so pharmacology of idozuridine. Now, for the idozuridine drug, I won't actually like to waste our time here. It was one of the earliest antiviral drugs that was discovered. Okay, and it was mainly used in treating herpes simplex virus infections of the eye. Okay, that's idozuridine. So it's an antiviral drug. It's a pyrimidine nucleoside analog. Okay, is a thymidine analog with an iodine substitution. It is phosphorylated into its active triphosphate form. That means 3 phosphates will be added to it for it to actually become active. So it will go into the viral DNA, okay, and it will cause faulty base pairing. You know, this base is supposed to be paired to this base will be paired to this base. That's what will now make the virus to keep making copies of itself. So this drug goes in and interrupts with this base pairing. So it will now cause the strands to break up. So this will now lead to what? Stopping the process of what? DNA synthesis. Do you understand that kind of thing? So absorption is poorly orally available. Okay, so it's usually given. What I'm seeing here is mainly in eye drops. Okay, so we said it's used in treating herpes simplex infections of the eye. So it's usually in eye drops. So distribution is usually topically. Metabolism, it will minimally go into the system because you're just applying it to the eye. So it's just local actions. So half-life is short. Okay, it's not well documented. Now it's mainly used in treating what? Herpes simplex virus eye infections known as the herpes simplex keratitis. Okay, it's also used in treatment of cutaneous herpes simplex virus lesions. You know, so it can cause irritations, can cause pains, can cause photophobia, can cause punctate keratopathy. All of these are the adverse effects of these drugs. So that's it for idozuridine. We'll quickly try to move to the next antiviral drug. I told you guys that we're doing 50 this night. I think I'm about 35. So I left with like 15 videos to go. Okay, I've done 100 minutes. 100 minutes, that was 1 hour 40 minutes. Well, let's go. We can't leave the work of today for tomorrow. Okay, so let's move to the next antiviral drug. Okay. Yo. Now, for the next antiviral drug which we'll be talking about is what is known as a glecaprevir. Glecaprevir. Okay, glecaprevir. Now, for the glecaprevir, we have it here. We said that it's a direct acting antiviral drug. Okay, so it's used in the treatment of what? Hepatitis virus infection that's been there for a very long time. So you see that's a chronic hepatitis C virus infection. So they usually combine it with what? Pibrentasvir. Okay, so when they combine it with pibrentasvir, they call it the Maviret. Okay, that's usually the brand name that comes with that. Okay, so how does it work? It actually blocks a very important enzyme in hepatitis C virus. That is known as the NS3 4A protease enzyme. Okay, so it inhibits the enzyme. Do you understand? So when you inhibit the enzyme is very important for polyproteins to be cleaved into functional proteins. So by blocking the enzyme, you are blocking polyproteins from becoming functional proteins. So thereby, you are blocking viral replication. The virus will not be able to make copies of itself again. So you are suppressing the hepatitis C virus infection. Okay, so it's orally administered, highly protein bound, about 97%. Metabolism is in the liver via the cytochrome 3A4 enzymes. Excretion is mainly fecal. Half-life is about 6 hours. Now, therapeutic use is mainly used for hepatitis C virus infection, and it's usually combined with what? Pibrentasvir. Okay, that's a Maviret. Okay, so adverse effects is just headache, fatigue, nausea. Okay, it also cause elevated liver enzymes. I'll be uploading everything. Okay, all the videos I'll be making this night, I'll be uploading them on the Pharmacology channel. Now we'll move to the next drug. Okay, and this is an antiretroviral drug. Okay, so this is an antiretroviral drug, and this is what is known as efavirenz. Efavirenz. So pharmacology of efavirenz. Okay, so efavirenz, just so you know, is an antiretroviral drug. It's used in the treatment of HIV, that's especially the HIV-1 infection. Okay, so it was one of the earliest and firstly discovered type of what? HIV drugs classified under the non-nucleoside reverse transcriptase inhibitors. So it's often included in the first line of treatment for HIV. Okay, so the drug profile proper now is a non-nucleoside reverse transcriptase inhibitor. It binds directly to HIV-1 reverse transcriptase. Okay, at a site, okay, that is away from the active site. Okay, so when it binds to the enzyme, that's the HIV-1 reverse transcriptase, it will stop the enzyme from becoming active. So for the enzyme to become active, there are some 1 or 2 changes that should come in for the enzyme to become active. So when you stop the enzyme from undergoing those changes, you are stopping the enzyme from becoming active. So this will now prevent conversion. That's the enzyme, when it becomes active, it should actually change the viral RNA into the DNA. So if you inhibit the enzyme to stop the enzyme from changing viral RNA to DNA, okay, so this will now what? Stop replication. Okay, so it's effective against HIV-1 only, not HIV-2, which is common in West Africa. So absorption is oral administration, distribution is highly protein bound, metabolism is extensively metabolized in the liver, excretion is mainly fecal elimination, half-life is about 40 to 55 hours. So therapeutic uses is used for HIV-1 infections treatments, okay, in adults and children, but the children should be more than what, above 3 years. Okay, so that's what we got. Adverse effects is rashes, dizziness, headaches, insomnia, fatigue. Okay, so that's what we got for efavirenz. Okay, so step onto the next drug. All right, step onto the next antiviral drug, and the next antiviral drug we should be discussing is what is known as what, elvitegravir. Elvitegravir. So for elvitegravir, we have it here. So it's actually an antiretroviral drug. When I say a drug is antiretroviral, it's used in treating HIV infections. So it belongs to the class of integrase strand transfer inhibitors. Okay, so class integrase strand transfer inhibitors. So how does this drug work? So they bind to a HIV-1 integrase enzyme. That's a type of enzyme in HIV-1. The enzyme is responsible for integrating what, the viral DNA into the host genome. So when you block that enzyme, you block this step of strand transfer for integration. Okay, so this will now prevent what, DNA formation. Okay, of course, that process is very important for the virus to actually keep moving. So you actually stop the virus from forming copies of itself. So absorption is oral administration, absorption is enhanced with food, distribution is highly protein bound, it's metabolized in the liver, excretion is mainly through the feces, half-life is 8 to 9 hours. So it's used mainly for treating HIV-1 infections, and that's in adults. And for children, the children should be actually more than 12 years. Okay, so it's commonly combined with other drugs like emtricitabine, tenofovir, okay, and the rest of it. So adverse effects is nausea, diarrhea, headaches, insomnia, okay, lactic acidosis, hepatotoxicities. So that's what we got for elvitegravir. Okay, so with this, I think I should take up like a 2 minutes break. Let me just eat a little food. Okay, take a 2 minutes break. Come. Yo. I'm coming, guys. I'll soon be back. Oh, I've been on live for like 2 hours and I just need to eat a little food. Oh yeah. Oh. I'm actually hungry, man. I'm tired, man. For real. I'm even done. Yo, feeling so cold, man. I think we're left to like 15 drugs to go. Yo, this is crazy, man. I just don't want to push this work till tomorrow. Do you understand? Because tomorrow I have a different thing to do. I don't want this thing to reach tomorrow. It's midnight, but I'm still working. Okay, so we'll move to the next drug. Now, this next drug is what is known as what? The Favipiravir. Okay, so Favipiravir goes by a popular brand name, which is known as the Avigan. So Favipiravir, have it here. So it's an antiretroviral. It's an antiviral drug. Sorry, not antiretroviral. So it's an antiviral drug. It was developed in Japan. It was mainly used in treatment of what? Influenza virus infections. Okay. But later on, it was used in treating Ebola virus infections and also COVID-19. Okay, Favipiravir. So, what is the drug profile like? So, first of all, you should know that it's a nucleoside analog antiviral drugs. So, it's a prodrug. That means it will be converted to what? Its active form. So, the active form is what is known as a Favipiravir ribofuranosyl 5-triphosphate. So the active metabolite is what will now inhibit what? The conversion of RNA into DNA in viruses. Okay, so it incorporates into the viral RNA, leading to chain termination. Okay, chain termination. So that means the RNA will not be converted to DNA. You understand? So pharmacokinetics is orally administered. You know, distribution is widely distributed, crosses into tissues. Metabolism is mainly in the liver by the aldehyde oxidase. Okay. Excretion is mainly through the urine. Half-life is about 2 to 5 hours. So it's approved in Japan mainly for the treatment of influenza. Okay. And of course, any other country that imports stuff from Japan should also be using this drug. So it's also used in treating Ebola virus infections, Lassa fever, the COVID-19. Okay, so that's it for this drug. So adverse effect is diarrhea, nausea, elevated uric acid levels. Okay, so that's what we got for the Favipiravir. Okay, I'll quickly try to move to the next drug. Now this one is quite popular too. Okay, this drug is quite popular too. Now this is what is known as the nevirapine. Okay, so talk about the pharmacology of nevirapine. So nevirapine is quite a drug that I've seen the name in so many places, and I've guessed so many other people to have seen this drug. So nevirapine, just so you know, is an antiretroviral drug. Is used in the treatment of HIV-1 infections. So which class of drug is this? It belongs to the non-nucleoside reverse transcriptase inhibitors. So those class of drugs, you call them, you abbreviate them as what? The NNRTIs. So how do they work? They bind to a very important enzyme in the HIVs, and this enzyme is known as a HIV-1 reverse transcriptase. So when they bind to this enzyme, they stop this enzyme from becoming active. Okay, so um, it will now prevent the conversion of what viral RNA into DNA. That would have been a process that would have gone on. That's if that enzyme was active. Okay, so it will now halt what the replication. That's the enzyme. That's it to halt the virus from making other copies of itself. So it's active against HIV-1 and not HIV-2. So administration is oral tablet or suspension. Absorption is good bioavailability. Distribution widely distributed. Um, Metabolism is in the liver. Okay. Excretion is mainly through the urine. Okay. So half-life is about 25 to 30 hours. All right. Therapeutic use is used in treating HIV-1 infections in adults and children. Okay. So that's what we got. So adverse effects is rashes, nausea, fatigue, headaches. Okay, hepatotoxicity is too. Then Steven Johnson's syndrome can also come in. Okay. Now for the next antiviral drug, we got it here. Now for the next antiviral drug is quite a popular one. This is what is known as a lamivudine. Lamivudine. So for the lamivudine, um, is pharmacology. So lamivudine, we said that it's actually a widely used antiretroviral drug. Okay, lamivudine is very popular even on its own. Okay, so which class of antiviral drug does it belong to? It belongs to the nucleoside reverse transcriptase inhibitor class. Now, how does this class work? First of all, it's a cytidine analog. Okay, so when it gets into the cell, um, 3-phosphates will be added to it for it to actually become active. So it becomes what? Where it becomes phosphorylated. Okay, so you call it lamivudine triphosphates. So when it becomes active, it competes with natural nucleotides, then it gets into the viral DNA. When it gets into the viral DNA, it now becomes a bad guy by terminating the chain. Okay, it will inhibit the HIV reverse transcriptase enzyme to terminate the chain. Okay, so it doesn't affect human cells, only affects what? HIV cells. So absorption is rapid and complete oral absorption. Distribution is widely distributed. Protein binding is low. Metabolism is in the liver but it's minimal. Elimination is mainly through the kidneys. Half-life is about 5 to 7 hours. Okay, so therapeutic use is just mainly used in treating HIV-1 infections and also hepatitis B virus infections. Okay, so can also suppress hepatitis B virus what? Replication. So adverse effects is headache, nausea, fatigue, diarrhea, insomnia. Okay, can also cause lactic acidosis. Okay, so this will quickly move to the next antiviral drug. Okay, now um, for the next antiviral drug which we have before us, we'll be talking about what is known as a ganciclovir. Ganciclovir. Now, for the ganciclovir, we said that it's an antiviral drug. It's primarily used in the treatment of what? Cytomegalovirus infections. Okay, so mainly in people that have had HIV. So you have HIV, your immune system is weak. You have organ transplant, so they have been giving you all those immunosuppressive therapies, so your immune system is weak. Okay, if you're undergoing chemotherapy, one of the general side effects of chemotherapy is weak immune system. So you are prone to have all the cytomegalovirus infection. So you use a ganciclovir drug to actually calm that down. So it's a synthetic nucleoside analog of guanine. It is phosphorylated, okay, by the viral kinase, okay, and then by cellular kinases just to activate it, okay. So when it is activated, it becomes ganciclovir triphosphate. It will now compete with the viral DNA polymerase. Then it will now go into the viral DNA. But when it gets into the viral DNA, it doesn't promote growth, it rather terminates. So it causes what? Chain terminations. Okay? So it affects only the viral cells and not the human cells. Absorption bioavailability is low, distribution is widely distributed, metabolism, of course, it will be phosphorylated, red 3 phosphate will be added so that it becomes active. Now, excretion is mainly through the urine. Half-life is about 3 to 4 hours. Now, indication is used mainly in treating cytomegalovirus infections, like retinitis caused by cytomegalovirus, colitis caused by cytomegalovirus, pneumonitis caused by cytomegalovirus. So adverse effects: fever, rashes, diarrhea, nausea. Okay, they sometimes can also cause some bone marrow suppressions. All right. Now, for the next drug, which we'll get to discuss, it's pharmacology. Um, we get to talk about what is known as a lopinavir. Okay, lopinavir. All right. So for the lopinavir, we have it here. So first of all, as an introduction, it's an antiretroviral drug. Okay, so it's used in the treatment of HIV-1 infections. It belongs to the HIV-1 protease inhibitor class, and it is usually combined with ritonavir, lopinavir, ritonavir. They usually combine these two. So how does it work? It's a protease inhibitor, so it will inhibit the HIV-1 protease enzyme. Okay, so that's the enzyme that if it was freely living, it would have cleaved the viral polyproteins into functional proteins. So by inhibiting the protease enzyme, yes, the virus will be forming copies of itself, but these copies will never mature. Do you understand? So, of course, if you don't have mature copies of the virus, they are harmless. So, when it's combined with ritonavir, it will stop anything that would degrade lopinavir. So, it actually serves as a booster. Do you understand? So, pharmacokinetics is usually given as oral tablets. Absorption is enhanced with food. Distribution is highly protein bound. Metabolism is via the cytochrome 3A4. Excretion is mainly through the feces. Half-life is about 5 to 6 hours. It's mainly used in treating HIV-1 infections. Okay, so it's also investigated for treatment of COVID-19. It can cause diarrhea, can cause nausea, can cause abdominal pain, can cause headaches, can cause fatigue. Okay, so that's it for lopinavir. Okay, pharmacology of lopinavir. Now, For the next drug, which we'll discuss, its pharmacology, is what is known as a nelfinavir. Okay, pharmacology of the next antiviral drug, and the drug on our list is uh, nelfinavir. Okay, so for nelfinavir, we said as an antiretroviral drug. Now, once you say a drug is an antiretroviral drug, it is actually used in treating HIV infections. So it belongs to the protease inhibitor class. So it was one of the earliest types of protease inhibitors that was ever discovered by man. Now, it's a HIV-1 protease inhibitor, okay, and it inhibits the HIV-1 protease enzyme. The enzyme is very essential for turning polyproteins into functional proteins. Do you understand? And those functional proteins are very important for viral particles to become infectious. Do you understand? So, once you have those, how will I put it? Once the viral particles don't have the functional proteins, you have them, they will never get matured. Okay, they'll be immature. So that means the virus will be making copies of itself, but these copies are immature. So thereby, they are harmless, they are non-infectious. Okay, so you should know that the drug nelfinavir is active against HIV-1 only and not HIV-2. So it's usually given orally. Its effect is enhanced with food. Distribution is highly protein bound, about 98%. Metabolism is in the liver. Excretion is mainly through the feces. Half-life is about 3.5 to 5 hours. So it's mainly used in treating HIV-1 infections in adults and also children. All right. So adverse effects can cause diarrhea, which is the most frequent adverse effect. It can also cause nausea, can cause flatulence, can cause rashes. Okay, it can cause lipodystrophy, insulin resistance, hyperglycemia, then also dyslipidemia. Okay, so that's it for nelfinavir. Now, for the next sub drug, it's kind of like an investigational drug that they are still working on. Okay, so this investigational drug is what is known as a Pritelivir. Okay, so Pritelivir is an experimental antiviral drug. So mainly they are experimenting on it for possible use in treating herpes simplex virus infections. That's the type 1 and type 2. Do you understand? So we'll talk about drugs that are in use and also drugs that they are still working on. Do you understand? So, what is the proposed action of this drug? It is proposed that it will inhibit the herpes simplex virus helicase primase complex. Now, that complex is very important, okay, for unboxing of the DNA. They call that unwinding of the DNA. So that's the process that should initiate DNA replication. So to prevent helicase or primase catalytic cycling, thereby this will halt viral DNA synthesis. So, do you understand? So, pretty liver. So administration is oral, metabolism is hepatic, excretion is fecal, half-life should be long enough for once daily dosing. So it's been experimented upon for treatment of what herpes simplex virus type 1 infections, herpes simplex virus 2 infections. So it's currently in clinical trials. So adverse effects is proposed that things like headache, nausea, and rashes. Okay, so that's what we have for the Pritelivir. Okay, we're gradually coming to the end of this live, I think we have just some few drugs, then we'll be packing up. Okay, so um, for the next drug which we'll get to discuss, it's pharmacology. This is what is known as a penciclovir. Penciclovir. Okay, so for the penciclovir, we said that it's an antiviral drug. It's used topically. So if you see the pictures which I have on my system, is mainly cream. Okay, so it's mainly for topical use. Rub it on your skin, okay, for an infection. Okay, so it's topical use for herpes simplex virus infections, especially for cold sores. That's herpes simplex virus infections on the mouth. You rub it. So it's a guanine nucleoside analog antiviral. Is phosphorylated by viral thymidine kinase, then by cellular kinases, so to be converted to active triphosphate form. Now the active form is what will competitively inhibit viral DNA polymerase. So this will now stop the process of what? Formation, that's DNA synthesis. Okay, so it will only act on infected cells and it will leave normal cells. So administration is usually rubbed on the skin, okay, a topical cream, so it doesn't get into the system. Distribution just at the site of application. Okay, half-life is about 10 to 20 hours. So therapeutic use, mainly used for what? Treatment of herpes labialis, that's cold sores caused by herpes simplex 1 infections. So adverse effects is just mild local reactions where you rub the cream, like erythema, burning, and itching. Okay, so that's what we got. Now on to the next drug, which we discuss. On to the next drug, which we get to discuss. This is what is known as an Indinavir. Okay, pharmacology of Indinavir. So for the Indinavir drug, we said that it's a drug that belongs to the class of protease inhibitors. Okay, so it's used in treatment of HIV infections. Okay, so it was a very important drug back in the 1990s. So how does it work? It binds to the HIV protease. That's a very important enzyme that um, should turn viral polyproteins into functional proteins that are essential for the virus to mature. Okay, so when it blocks the protease enzyme, you are blocking formation of what? Important proteins that the virus needs to mature. So quite all right. The viruses that already exist will be forming copies of their self, but these copies will never mature. So if you have these copies not maturing, you say you have immature, non-infectious viral components. So those ones, they are harmless to you. Okay, your immune system can easily take them out. So it's usually administered orally. Okay, there's moderate protein binding, um, hepatic metabolism via the cytochrome 3A4 is excreted via feces. Half-life is about 1.5 to 2 hours. So it's mainly used in treating HIV infections. Okay, it can cause nausea, diarrhea, abdominal pain, headaches, and also fatigue. So that's it for Indinavir. Okay, now for the next drug, okay, almost coming to an end. I think just about 5 drugs now and we are done. So we're looking at a drug known as the Pharmacology. Okay, pharmacology of Pharmacology. So for the Pharmacology, What we have, we should know that it's an oral drug. It's used in treating herpes infections, like the herpes simplex virus infections and the varicella zoster infections. So it's a prodrug of penciclovir. That means if I give famciclovir to you, it gets into your system turns it to penciclovir. Okay. So class is a guanine nucleoside analog antiviral. Okay. So famciclovir will be converted to penciclovir, okay, when it gets into the body, okay, by phosphorylation, okay, by an enzyme known as a thymidine kinase, okay, then by cellular kinases. So the active form, which is known as the penciclovir, is the one that will now go to inhibit DNA polymerase. So this will block DNA synthesis, okay, then viral replication, okay. So it will selectively what? Attack cells that are affected, okay, or cells that are infected. So absorption, there's good bioavailability, distribution is widely distributed. Metabolism, of course, famciclovir will be converted to penciclovir later on. Now, excretion is mainly through the urine. Half-life is about 2 to 3 hours. So it's mainly used in treating herpes zoster infections, that's shingles, genital herpes infections, then herpes labialis infections, that's cold sores on the mouth, and all of that. Okay, so adverse effect is headache, nausea, diarrhea, and fatigue. Okay, so that's it. Almost coming to an end. I think we just have like 4 videos to go. Now, for the next drug, for the next viral drug or antiretroviral drug, which we'll talk about, is what is known as a Maraviroc. Okay, so pharmacology of Maraviroc. So for the Maraviroc drug, just so you know, it's an antiretroviral drug. Okay, so it's used in the treatment of HIV-1 infections. So it's unique among the HIV therapies because this one, it targets a host cell receptor. Okay, so it's a CC5, okay, CCR5 receptor antagonist. That means it will target what? The CCR5 receptor. Now, the HIV actually requires those receptors, okay, to be able to enter into your CD4 T cells and destroy them. So when you block those receptors, the HIV virus is not able to go in. So Maraviroc will block the receptors. So this will now prevent the virus from attaching and entering the cell. So, it's effective against HIV-1, okay? So usually oral tablets, there's good oral bioavailability. Distribution is about 76% protein bound. Excretion is mainly fecal. Half-life is 14 to 18 hours. There is mainly used in treating HIV-1 infection in adults and also children. Okay, so adverse effect is cough, can cause fever, can cause rashes, abdominal pain, dizziness. Okay, so that's what we got for this Maraviroc. Now, um, on to the next. On to the next drug. Now, for this next drug is what is known as a molnupiravir. Molnupiravir. So for the molnupiravir drug is what we are discussing next. So it usually goes with the brand name Lagevrio. Lagevrio. Okay, so it's an oral antiviral drug. It's mainly used in the treatment of COVID-19. Okay, so class is a ribonucleoside analog antiviral drugs. So how do they work? First of all, you should know that the molnupiravir is an active drug. It's a prodrug. It needs to be converted to the active type. So the active type is the N-hydroxycytidine. Okay, okay, N-hydroxycytidine. So when the N-hydroxycytidine is formed, it goes into the viral RNA, and of course, it will um, cause a lot of mutations into the viral RNA. Okay, so it will cause error catastrophe. That's what they call. Okay, things are not going on as planned in the viral cell again. So it's usually given in oral capsules. There's good oral bioavailability. To be converted, like we spoke. Okay, it's excreted via the renals. Half-life is about 3 to 4 hours. Okay, so it's mainly used in treating mild to moderate COVID-19. So adverse effects is diarrhea, nausea, dizziness, headache. Okay, so that's what we got. Okay, for molnupiravir. Quickly move to the next drug. Okay, quickly move to the next drug before us. All right. Now, for the next drug before us, we'll get to talk about the drug which is known as the nirmatrelvir. Okay, nirmatrelvir. Now, for the nirmatrelvir drug, you should know that it's an oral antiviral drug, and they usually combine it with ritonavir. Like most of the times, you see it being sold with ritonavir. Okay, not alone. So it's mainly used for the treatment of COVID-19. It's a protease inhibitor. Okay, so it's said as a 3C-like protease inhibitor. It targets the main protease of the COVID-19. That's the enzyme that is very important for conversion of polyproteins into functional proteins. So those functional proteins are needed for the virus to keep making copies of itself, and those copies getting matured. Do you understand? So once you inhibit the enzyme, it will stop the virus from what? Making copies of itself. So you see there's termination of viral replication. Okay, so administration is oral tablets, absorption is good bioavailability, metabolism is via the cytochrome 3A4, excretion is mainly through the kidneys. So half-life is about 6 hours. It's mainly used in treatment of COVID-19, okay, for children that are more than 12 years up. Okay, so adverse effects is diarrhea. It can alter your taste. That's dysgeusia. Can cause hypertension and sometimes muscle aches. That's nirmatrelvir. Okay, so we're gradually coming to an end. Now, for the next drug, which we discuss, is pharmacology. This is what is known as a paritalprevir. Okay, paritalprevir. Now, for the paritalprevir, just so you know, it's an antiviral drug. It's used in the treatment of chronic hepatitis C virus infection. Okay, so it blocks a very important enzyme in the hepatitis C virus. Okay, and that enzyme is known as the NS3/4A. So you now call the drug an NS3/4A protease inhibitor. Okay, so that enzyme should be very important in converting polyproteins into active proteins or functional proteins. Now, those proteins are very needed for the virus to keep making copies of itself. So if you block the enzyme, you block the protein formation, so you block viral replication. Do you understand? So they usually combine it with ritonavir, okay? Because ritonavir will block anything that could have broken down this paritalprevir faster. Okay, so it called as a booster dose. So administration is oral, absorption is enhanced with food, distribution is highly protein bound, metabolism is through the liver, excretion is mainly through the bile and the feces. Half-life is about 5.5 hours. So they use it in treating chronic hepatitis C virus infections. Okay, so these are all the combinations, okay, right here, which I'll upload and you guys will see. So adverse events can cause fatigue, can cause nausea, can cause pruritus, can cause insomnia, can also be toxic to your liver. Okay, so that's it for the parita preview. Yeah, are almost coming to an end. All right. Now for the next drug which we discuss, it's pharmacology. This is what is known as a lenacapavir. Lenacapavir. Now, lenacapavir actually goes by a very popular brand name, which the brand name could sometimes even be much more popular than the real name, known as a Sulenka. Okay, lenacapavir. So for this drug, it goes by a brand name known as Sulenka. It's a novel antiretroviral drug. So it's mainly used in treating what HIV-1 infections. So it represents a new class of therapy called the capsid inhibitor. So what's the class? Is a HIV-1 capsid inhibitor. So it binds to the HIV-1 capsid protein. This will now disrupt multiple stages of viral replication cycle. So it will block import of viral DNA. It will also block assembly. It will also block that process of release of new variants. So three processes are blocked by this lenacapavir. So it provides activity against HIV strains that have been resistant to drug treatment for a very long time. Okay, so pharmacokinetics, you usually give it oral tablets or subcutaneous injection. So the injection is long acting, okay, can last up to 6 months. So distribution is widely distributed, excretion is mainly feces. Half-life, the oral one, at least 10 weeks. Okay, so it's mainly used in treating HIV-1 infections. Okay, and they usually combine it with other antiretroviral drugs. So side effects is for the injection, you can have injection site reactions like redness, swelling, pain. You understand? So that's what we got for the lenacapavir. Okay. Now moving to the next drug, which is almost at the end of this live. We'll talk about what is known as lanimavir. Okay, lanima. Okay, laninamivir. Okay, so the popular brand name was Inavir. Okay, so um, it's actually long acting. It's an inhaled neuraminidase inhibitor. So it's an inhaler. Okay, so anything inhaler, of course, is mainly used in treating respiratory tract infections. So it's mainly used in treating influenza A and influenza B types of infections. Okay, so it's a neuraminidase inhibitor. So it's an active metabolite of lanimavir octanoate, which is a prodrug. So after you inhale it, the lanimavir octanoate, it is converted to this lanimavir. Okay, so it will bind to and it will inhibit the influenza virus neuraminidase, which is a very important enzyme that um, releases what new copies of those virus from infected cells. So this will prevent the release of new copies of virus, and this will prevent the spread of the infection. Okay, so administration is inhalation. It will act in the respiratory tract. it will be sustained in the airways. Okay. Primary is renal excretion. That's the excretion of drug is primarily what? Renal. So half-life is actually what? Long-lived. So it's usually used in treatment of influenza A and B infections. So you can cause cough, throat infection, irritations rather, headache, can cause nausea and diarrhea. So sometimes can also cause complications in patients that already have asthma and COPD. Okay, so almost to the end right now. So we are looking at the next drug, which is known as a Peramivir. Okay, so pharmacology of Peramivir. Now, Peramivir actually goes by a very popular brand name, which is known as a Rapivab. Okay, and I think that's it. So, for Peramivir, what we have here is this. So it goes by a very popular brand name, Rapivab. It's an antiviral drug. It's used in the treatment of influenza virus infection. So, class of drug is a neuraminidase enzyme inhibitor. Okay. So to inhibit this neuraminidase enzyme, which is usually found on the surface of influenza virus. So if you stop that enzyme, you stop the release of new viral particles from infected cells. Do you understand? So this will now limit the spread, okay, of the viral infection in the respiratory tract. Okay, so it's actually used in treating influenza virus, which is a respiratory tract infection. So administration is actually intravenous. Okay, so this one is not inhalational now. So distribution is widely distributed. It's primarily what? Clear through the kidneys. Half-life is about 20 hours. So it's used in treating acute uncomplicated influenza in patients, especially useful for patients unable to take oral or inhaled antivirals. So they just give it to you through the veins. So it can cause diarrhea, nausea, neutropenia. Okay, then sometimes hypersensitivity reactions. Now, for the last drug before we end this live, okay, this is a drug known as the oseltamivir. Oseltamivir. Okay, it goes by a very popular brand name known as a Tamiflu. Okay, oseltamivir. Now, for the oseltamivir, we should know that it's an antiviral drug. It's used for the treatment and prevention also of influenza A and B virus infection. Okay, so what is the drug class? Is a neuraminidase inhibitor. Okay, so it's a prodrug. That means it will be converted to the active metabolite, which is known as the oseltamivir carboxylate. Okay, so when it's converted to the active metabolite now, it will inhibit an enzyme known as a neuraminidase enzyme. Okay, that is usually on the surface of influenza virus. Now that enzyme is very important for the release of newly formed virus. You know, the virus is steady forming copies of itself. So when you inhibit the enzyme, you inhibit the release of these newly formed viruses. Okay, so this now limits the spread of the infection. So it's very effective against the treatment of hepatitis M, influenza A and influenza B virus infections. Administration is oral, absorption is well absorbed, distribution is widely distributed, metabolism is through the liver, excretion is through the kidneys, half-life is about 10 6 to 10 hours. Okay, so it's used in treating acute uncomplicated influenza. Can also be used in the prevention of influenza of individuals that actually stand a risk of having it. So it can cause nausea, can cause vomiting, can cause headaches. All right. That's what we got for oseltamivir, Tamiflu. All right. So with that, I think we have actually come to the end of this live. Okay. Talking about the first set of videos for antiviral drugs. The total antiviral drugs that are active in the world is about 75. We did 50 today, so I just left it only 25. Okay, so I reduced a lot of work today. Tomorrow we'll complete it. Okay, tomorrow or next, okay? We'll make sure that it's actually completed. Okay, so let me off my AC now. Since my laptop will be off too. Now, bye guys.